Gonorrhea is a deadly STI. Deadly in the sense that it has terrible complications. STI means sexually transmitted infection. Gonorrhea is common in sexually active adults. It can be contracted through oral sex, through anal sex, through vaginal sex. Please, if you are having any of these symptoms, painful urination, you are passing hot urine, you are having discharge from your penis or your vagina that is whitish or yellowish, or that is like pus that stains your cloth, stains your boxers, or you are having pelvic pain, or you are having pain in your testes for the men, or you are having painful sex as a woman, properly treated. Gonorrhea has terrible complications that you do not want to have. It causes urethral stricture in a man. Urethral stricture is obstruction of your urinary pipe. Sometimes it obstructs completely that urine cannot find a way through. In such cases, patients will come in as an emergency with what we call acute urine retention. And we have to divert the urine because when you pass a tube through your penis, it will not pass through. So most times we have to put a tube under the belly button. Now, urethral stricture is the terror of every man because even after surgery, sometimes we operate 6 times, it still recurs. We always say, once a stricture, always a stricture. It is not what you want. Please, if you have any of these symptoms, do well to visit a urologist and get properly tested and treated. Other complications are, it can affect your kidneys, causing inflammation of your kidneys. It will cause scarring. Even the surrounding structures will have adhesions. At the end of the day, the kidney will be obstructed, the flow of urine will be obstructed. And when the flow of urine is obstructed, what happens to your kidney? It starts swelling up, what we call hydronephrosis. It can also affect your fertility because it will cause scarring in your epididymis, which will obstruct the flow of sperm from your testis into your ductus, the tube that connects your testis to your penis. If that tube is obstructed, your testis is producing the sperm, but it cannot pass through due to scarring of your epididymis. It can also block the tubes in a woman. These are terrible complications that you do not want. So please, if you are sexually active, do well to practice safe sex. Use barrier methods like condoms. If possible, abstain completely from sex until you have your own life partner. Please make sure that you visit your doctor always and get regularly tested for STIs. This is the only way to avoid gonorrhea and chlamydia and other sexually transmitted infections that we are going to be discussing on this channel. I remain Dr. Nwichi Frederick. Investment in your health is your wisest decision.